Dear viewers, you're going to see phacoemulsification with Ophtec Precizon Presbyopic IOL using IOL-matic injection system. This surgery is being performed by poet ophthalmologist Dr. Ziaul Mazhari. So basically, the Precizon Presbyopic IOL is designed with a patented Continuous Transition Focus optic. This optic has multiple segments for far and near on its anterior surface, and there's a continuous transition from far to near, so a perfect intermediate vision is achieved as there are no steps or rings in this IOL design. So we'll proceed with the phacoemulsification of this patient. A temporal 2.75 millimeter incision is being fashioned with the help of a keratome in a biplanar way, followed by intracameral injection of xylocaine and adrenaline, and followed by a good fill of OVD in the anterior chamber, making sure that the anterior chamber is formed before proceeding with capsulorhexis, and cornea is also, the anterior surface of the cornea is with the help of OVD so that we have a clear view and to protect the anterior surface of the cornea. Two side ports are being formed with the help of a 15-degree blade. We go in with 27 gauge needle and start the capsulorhexis from 9 o'clock position and proceed in a clockwise fashion, making sure that the flap of the rhexis is always laid on the anterior capsule, and a continuous curvilinear central capsulorhexis has been performed, and hydrodissection is being performed now in multiple quadrants, followed by hydrodelineation, and you can see a beautiful yellow ring. And we are making sure that the nucleus is rotating. As someone says, if you cannot spin, you cannot win. So this maneuver helps you in after phacoemulsification, while taking up the perinucleus and cortical matter. This maneuver always helps you and saves your time. So now surgeon proceeds with phacoemulsification, going in from the temporal side, and the second instrument goes in from 11 o'clock. So it's a perfect V-shaped maneuvering, and the shaving of the perinucleus and cortical matter to proceed with a direct chop, burying the phaco tip in the center, and a partial chop is created. And then as the nucleus was relatively soft, so the pieces of nucleus are being emulsified, continuously chopping them into further smaller pieces with the help of second instrument, and the rest of the nucleus is also emulsified, followed by perinucleus. Perinucleus, as we had a good spin, so perinucleus also smoothly goes into the phaco tip with the help of aspiration. Now we dislodge the remaining perinucleus and proceed with a coaxial IA probe. It's a J-shaped coaxial IA probe. It also helps you to aspirate the subincisional cortex in a smooth way, and you don't have to enlarge the other side port while using this coaxial IA probe. So this is Precizon Presbyopic IOL by Ophtec with IOL-matic injector system, and the assistant has started unpacking the IOL while we are cleaning or polishing the posterior capsule of the capsular bag. And this is the IOL-matic injector system unpacked, hands it over to our assistant. This is the IOL is already preloaded into the cartridge, and this is the cartridge of this Precizon IOL, which already has the IOL present within it. And we coat the anterior surface of the cornea with OVD and we have filled the eye with OVD, and anterior chamber is well formed, and the bag is inflated with the help of OVD to proceed with the delivery of intraocular lens into the eye. And you can notice the assistant has handed over the injection system to the surgeon. We have to make sure that this lid of the IOL-matic system is fully elevated before locking or assembling the cartridge with this IOL-matic, and making sure that the cartridge is well locked. A click sound will be heard, and only after hearing that click sound you proceed with priming of the intraocular lens. So BSS, the IOL is washed with the help of BSS and followed by priming it with OVD, so that we have a smooth delivery of intraocular lens and it doesn't get stuck during the delivery. We make sure that the haptics are well placed, lock the cartridge. So we must do every step under VN so that the chances of error are minimized, and the IOL is being positioned in a pre-delivery position. The nozzle of the injector system goes smoothly into the eye. It's a fine nozzle going in from a 2.75 millimeter incision, and the leading haptic goes directly into the bag. So we inject the intraocular lens in a slow motion, followed by the trailing haptic, which also goes directly into the capsular bag, needing no further manipulation with the help of second instrument. And we go in with a coaxial IA probe and watch the OVD in front of the lens and from behind the lens while gently rotating the lens with the help of this IA probe. So posterior surface of the lens is also cleared so that we don't have capsular distension syndrome afterwards, and the patient may achieve precise vision. So the case is closed and IOL is positioned in 3 and 9 o'clock position, and the wound is hydrated, and you see it's a beautiful outcome for the patient. And this lens has a beautiful design with those continuous transition zones, but there are no steps or rings in this intraocular lens, so that patient doesn't have halos afterwards. Thank you so much, viewers, for your attention.